terms of treatment options, the most common treatment still remains the CPAP machine. Okay, so there's a mask that covers either your nose and mouth or just your nose or just your mouth, and it's continually pushing that oxygen through so that your airway is staying open and your lungs are inflating and breathing as you go. Okay. They have made a lot of improvements in these over the last 5 years or so. It used to be that people would get their CPAP machines, they'd take them home, and within 2 nights they were in the hall closet. Okay. If the mask isn't fitted properly, and now they have a lot more flexibility in how to fit those, it can be very irritating for people if the air is just blowing on their face during the night. The other issue people were having is that the motors were loud, which they have now improved on. But so here they are, they can finally breathe all night and get a good night's sleep, and they have a loud motor right next to their head that's keeping them awake. So again, a lot of improvements have been made in that. Dental appliances work well for those individuals that have that small jaw or that large overbite, okay, or the recessed chin there. It repositions it. They look almost like the mouth guards that you would wear for football or sports, okay, and it just holds your jaw in place as you sleep to keep that airway open. So very easy for that. Most dentists can fit you for that as they go through. The newest treatment is a sleep apnea pacemaker. Okay, this was approved by the FDA back in March of 2014, and we're starting to see now where a lot of the major academic medical centers are sending staff to be trained on this, and then it will be rolling out through the country as more individuals get trained. What this does, it's different from the heart pacemaker that we typically associate. It's very small. It fits right up by your collarbone. Okay, and what it does is send mild electric currents, can't feel them, but it's sending that stimulus to the airway to stay open at night. Okay, so they've had great success with that. Surgery is also an option. Obviously, this is one that we try to do everything else on first because any surgery carries risks, but the surgery can remove some of that excess tissue and leave the airway more open. Okay. In terms of lifestyle, some changes there. If your sleep apnea is caused by excess weight, those excess tissues, losing weight can help with the sleep apnea. You want to avoid alcohol or make sure that it's fully metabolized through your system before you go to sleep. So try to allow at least 1.5 hours to 2 hours per drink. Quit smoking, okay, so you're not getting that inflammation, that chronic inflammation in the back of the throat, and side sleeping. So you can buy nice durable medical equipment supplies that are kind of like those baby bumpers that you may have used when your kids were younger. Okay, it stops you if you're sleeping on your side and you go to roll to your back, you run into it, okay, and it causes you to stay on your side. If you want to try this out, use your bed pillows at home to start. Make yourself a little wall, okay? For 2 or 3 nights, you're not going to sleep well. Because if you normally sleep on your back, every time you go to roll over, you're going to run into your wall of pillows there. But eventually, your body will recognize it and start rolling back over onto your side. So that may help for you, and you can try it out to see if that will work for you before looking into the durable medical equipment piece.